name is Sean. I'm a U.S. Army First Sergeant, retired, and I'm a program specialist here at the VA Nursing Service. According to the National Council on Aging, falls are the leading cause of injury in the 65 plus population. 1 in 4 older adults fall each year. The Center for Disease Control and Prevention identifies these fall risk factors: weakness, nutritional deficit, walking and balance problems, some medications, footwear, and environmental hazards. Some falls can be prevented. Now there's a new tool that nearly anyone can utilize to assess a person's mobility. It's quick, easy to learn, and helps direct staff, caregivers, or family to equipment technology to keep the patient and themselves safe. Let's look at what shouldn't happen. This veteran has an outpatient appointment.
Hi, sir. Welcome to the VA. Are you checking in today?
Yes. I'm sorry. I had a heck of a time moving around today.
That's okay.
Hi, doctor.
Hello, Mr. Jones. How are you doing today?
I honestly, everything has been more difficult. I've been having a hard time, just moving around.
Okay, I'll help you onto the cart.
The physician transfers him to the exam table without reviewing his current capabilities. Outcome is an injury for the staff member.
Hi, sir. I'm checking one of your nurses.
Yeah.
Can I help you with something?
Yeah, I gotta go to the bathroom real
Oh,
bad.
sure. Can we just wait one second?
No,
to
it's
see?
real urgent.
Okay.
I gotta go right away.
Okay.
Just help me get out of the
Okay,
bed. I can
sounds
walk
good.
fine, I think.
Let's
I
see
don't
if I
fall
can.
that often.
Would you mind if I waited to get some help?
No, I can't.
Okay.
But just help me up.
Sure,
No, that's my bad shoulder.
Okay.
Don't do that.
So sorry. We
I
wait
turned
for.
my bed alarm off already.
Okay.
The nursing assistant skips screening the inpatient's mobility capabilities due to an urgent toileting need.
Well, that was a little fast. I feel a little dizzy.
So
The
sorry.
patient falls.
Whoa.
Are you okay, sir?
Yeah, I'm okay.
Okay.
I fall all the time. I'm always okay.
I knew this was gonna happen.
Jeez. All right. Well, I'll call for some help and we'll get you up here. Okay.
Yeah, I need some help.
Okay.
Oh, we got time for some coffee. Yeah. I wish I had time for breakfast, but we ain't got time for that.
It'll be fine, hon. Just drink your coffee. We have time.
I got him.
You got
Yep. Well, Tom and his wife are if we're late.
it. All right, babe, let's go.
Oh, help me up a little bit.
You good?
Oh, just a little stiff, baby. Good. Can you reach by? Can for me, please? All right, babe. Let's go.
The family caregiver has successfully transferred the veteran into the car for church. When exiting the car,
No, babe, it's fine. We're gonna be late. Let's
Are you
go.
sure you don't
Yeah,
need
just
it?
give me your hand. Just give me your hand.
The doctor wants you to use the walker.
Just give me your hand. We're gonna be okay. Come on, let's go.
the caregiver falls in the parking lot. The excited veteran is the second victim and falls as well.
Oh,
Here, how can I help you guys?
Help me get up off of her so she's okay. Help me get up. Oh. Baby, are you okay?
Yeah.
Be careful. Where is it hurting at? Oh, wait a minute. Where are you hurt? Where's it hurt? Your arm? What about your back or your head? I think I hit my head a little bit.
Okay.
Can you call 911 for us?
Yeah, I can do that for you.
Okay.
You guys can get somebody here. That'd be greatly appreciated. All right, thank you.
Did you get them?
Yeah, they're on their way.
Okay,
you
thank
guys
you.
hurt or anything?
Her arm's hurting.
Hi, I'm Sandy. I'm the Chief Nurse of Professional Staff Development with the Cincinnati VA Medical Center. The VA MSST screens the patient's mobility level for the current patient care task. The screen was designed to be performed quickly and as often as required to determine a patient's current mobility level. For healthcare staff, screening would be performed upon admission, at shift change, and for any change in patient status. For family or caregivers, it could be done daily, weekly, or any time before the patient needs to mobilize. There are 5 levels to the VA MSST screening tool to determine if a person can mobilize independently. Each level is color coordinated, and levels 3 and 4 have 2 tasks to accomplish. Level 0 is a patient that is not available or unable to be screened. Level 1 is sit and shake. This demonstrates a patient's core strength, balance, and ability to follow commands. Level 2 is stretch and point. This demonstrates lower extremity strength and range of motion to perform standing tasks. Level 3P is stand. This demonstrates the ability to bear weight through the lower extremities, patient balance, and if support is required. Level 3N is march and step with support. This demonstrates dynamic balance and coordination to perform walking tasks. Level 4A is march and step without support. This demonstrates dynamic balance and coordination. An assistive device such as a cane or walker may be utilized in this step. Let's watch the VA MSST in action. Starting with level 0, this patient is not available or is unable to be screened. Examples would be an unconscious or heavily sedated patient, a patient in restraints, or a patient that refuses to participate in the screen. The next screening step is the sit and shake. If the patient screen starts from a lying surface, the patient must sit up independently and cross the body's midline to shake your hand. If the patient screen starts from a seated surface, the patient must move to sit unsupported and cross the body's midline to shake your hand. This demonstrates balance, core strength, and the ability to follow commands. If the patient cannot complete the sit and shake task, the patient is a level 1. If they can complete the task, you move on to the next task. From the current unsupported sitting position, now have the patient complete the stretch and point task. Ask the patient to stretch at least one leg and point with their foot. Ensure the patient remains free of any back or trunk support during this step. If the patient cannot complete the stretch and point task, the patient is a level 2. If they can, we move on. Next, ask the patient to stand. The patient can stand from the bed or a seated surface. They must stand for at least 5 seconds. The patient may utilize a support during this task. If the patient cannot complete the stand and support task, the patient is a level 3P, which means the patient requires a powered transfer device. With the patient standing from the previous task, have them march and step. Ask the patient to march in place approximately 4 to 5 times per leg. Then have the patient take a step forward and backwards on each leg. If the patient cannot complete both parts of the march and step with support task, the patient is a level 3N, which means the patient will require a non-powered transfer device. Lastly, see if the patient can march and step without support. Repeat the procedure from the previous task, but without any support. If the patient normally uses a cane or walker, it should be included at this task. If the patient can complete the task with an assistive device, the patient is a 4A. If the patient can complete this task without an assistive device, they are a level
I always
4.
put them in the
They
front
can
there.
mobilize independently. Remember though, please consider additional safety tools for patients assessed for high fall risk factors not included in the VA MSST. Let's put the VA MSST into action with the patients we met earlier, because using the VA MSST may have prevented negative outcomes. Screening can prevent patient falls, staff injuries, and
I have the
caregiver
QR code
distress,
saved on
and it provides
your doc
efficient,
that I
safe,
bring
and
up on the
dignified
screen.
veteran care. Consider our outpatient veteran that was transferred to the exam table that resulted in the doctor's injury. If the
I mean,
VA
how many
MSST
signs were
screening
there?
had been performed, it would have shown the patient's mobility level was a 3P. The staff member should have used a powered transfer device such as an electric sit-to-stand, and the staff member injury could have been prevented.
I'm so glad I used the mobility screening tool to prevent any back injury.
Next scenario was the inpatient veteran who urgently needed to use the bathroom. A screening would have shown his mobility was a level 2. The use of a ceiling lift with the proper sling to transfer the veteran could have prevented this patient's fall.
So in this situation, I was able to use the mobility screening tool to prevent a patient fall.
Lastly, let's revisit our veteran and caregiver in the home setting. The screening tool showed the veteran to be a level 4A that day. If the caregiver had performed the VA MSST screening tool, she would have been alerted to the veteran's need for an assistive device. The caregiver could have then encouraged him to use his newly issued walker.
Using the mobility screening tool, reduces my stress and anxiety in taking care of my husband.
And that in turn reduces mine because I don't want to be a burden to anyone. I just want us to be able to live safe, fear of falling or hurting anyone.
The VA MSST is one of many SPHM resources at our VA medical centers. Staff can use our internal SPHM SharePoint and documentation systems for more information. For our family members and caregivers, please ask your local VA staff for additional information or check out our new VA YouTube channel for more videos. From all of us at the Cincinnati VA Medical Center, thank you as we strive to provide the best experience for our nation's veterans.